This is Harvey Elwood for New Perspectives Media, 93.7, the People Station.
We're here at Claflin University. We're talking with a group of medical professionals that are here talking with young people about the importance of, and actually recruiting them and having them to have an interest in podiatry.
Hi, my name is Ron Ravenel. I live in Charleston, South Carolina, and practice at the Medical University of South Carolina here up at Claflin to talk about the profession of podiatric medicine and surgery.
How long have you done this?
I've been in practice now for about 11 years.
How important is it for you to reach out to students and invite them to join you in your profession?
It is extremely important. One of the things that I have noticed in my practice, Charleston is home for me, and I'm one of a few black podiatrists in Charleston, but we treat a various amount of types of disorders that affect people in our community. Diabetes being one of the most prevalent ones, peripheral vascular disease being another, and it's important for our patients to see people that look like us, that understand them on a more holistic level. So it's important for me to reach back and bring bright, smart students in that can take up the mantle when we're all gone. Somebody reached back and brought me into this, and so that's importance for it. This is Dr. Will Harris.
Dr. Harris, how you doing?
How you doing?
Tell us about the importance of the day and the events with the young people.
So the importance of today is we came as black podiatric surgeons to come and show the students who may not get much exposure as to what we do, to give them some more career outlook on possibilities that are available to them in the field of medicine. So.
Did someone do this for you when you were a student in undergraduate or graduate school? Someone looked like you.
No one did this for me as a student in undergrad. I had to reach out.
Right, so you all have actually created what is needed for this generation, and hopefully people will continue to do that behind you.
Yes, sir.
Well, that's commendable.
Because a bunion is a structural deformity, correct? It's the bone that's turned, it's the adductor tendon that's pulling on the proximal phalanx of the big toe and turning that toe that certain way. So when we fix a bunion, of course we have to cut tendons and cut bones. I don't care what you put in there. Yes, it'll help you walk and not have pain, which that's all some patients want. I don't want to have surgery. I don't want to get cut, Dr. Long. Okay, no problem.
So eventually I'm going to end up with the surgery with the passage of time, with the aging?
Well, you can look at it two ways. If it's not hurting, no. I've seen bunions that are god-awful and they don't hurt patients at all, so they never have to go to surgery.
Yeah, it gives me
but if
pain.
it hurts you and it's stopping you from doing your day-to-day activities, it's time for surgery.
I'm Dr. William Long. I practice out of Simpsonville, South Carolina. I'm a trustee of the American Board of Podiatric Medicine, and it's really important to have events like this to bring awareness to podiatric medicine and surgery, especially with a higher diabetic rate. African Americans having amputation rates 3 times higher than any of the general population. It's very important that we go out to the historically black colleges and universities and bring in our own. We have the best of the best. I mean, all these surgeons that we have here are literally the best in the field. I mean, seriously. I really believe that, and I believe we have the best students, across the country.
I'm Dr. Kevin Ray, and what's important about what we do here is this particular event was actually Dr. Long's brainchild, because he's a board member of the American Podiatric Medical Association. And as he said, and I'll say it again, at HBCUs we have the best and the brightest students. All of the surgeons that spoke before I did, they all went to the top residency programs. They all have the highest level of training in foot and ankle surgery. And most importantly, they all came back to South Carolina, where we have one of the highest rates of diabetic amputations in the country. I practice here locally in Orangeburg, South Carolina. Orangeburg County unfortunately has probably the highest rate of diabetic amputees, and my group and all of these surgeons, we're the best trained to really prevent this, and it actually affects Black America more than anyone else. So it's quite important that there are patients out there that are seeing doctors that look like them, so that thing we call cultural bias is somewhat mitigated, and we're able to really speak to the souls of these individuals to make certain that they get the care that they need. I thank you. I thank 93.7 for being here. You've always supported Claflin University and just Orangeburg community as a whole, Harvey. We greatly appreciate that, and we appreciate you for it.
Again, this is Harvey Elwood for Orangeburg Community Television, signing off.